to the second session at this discussion. This session is on euthanasia. The legal right to perform euthanasia to end suffering is a privilege of our profession. And the speakers in this session are going to discuss euthanasia. In particular, they're going to look at the decision about when is the right moment. So I'm going to introduce all the speakers all at once, and this session will be somewhat different to the normal, and it will certainly be informal, and I apologize if it turns into chaos. We have Peter Sando, who's Professor of Bioethics at the University of Copenhagen, and he will introduce the session. And then Roxanne Curtin and Kelly Eyre, who will both present actual cases, one's a cat, one's a horse, with decision moments to be made, at which point you're going to have to make your contributions, at least in raising or not raising your hand. Hence the informality. We've also got, Roxanne Curtin is head vet of the equine section of the RSPCA, and Kelly Eyre is a registered veterinary nurse who's the clinical lead at the Royal Canin Feline Healthy Aging Clinic at Liverpool University. And we also have here Susan Gregson, who's the founder and the managing director of Vets to Home, or Happy Partings? Peaceful Pet Goodbyes. She may not be doing anything formal, but has a very important contribution to make. So without more ado, Peter, please will you set the session going?
Thank you very much, Polly. We're going to talk about euthanasia. It's interesting. Vets tend to use the word euthanasia in a very broad sense of any killing. It causes a lot of controversy when you work in animal ethics. And I'm going to start discussing the broader issue of killing animals that could go on living an okay life. I should warn you, I'm from Denmark. We used to be the home of the giraffe Marius. Remember that story? It was the zoo giraffe that was put down, and no one in Denmark, well, that's what we do. And then it hit Russia, UK, US, and everyone was shocked. What are they doing? So there are really, really big differences about killing across cultures. I gave a talk a few years ago to vet students. I also teach vet students in Copenhagen. And I told them about the case Marius and asked how many would favor it. They said, oh, yes. Then I went to Barcelona, gave exactly the same talk, of course in English, to 300 vet students and asked them the same question. Do you know how many said it was a good idea? 0. So even within Europe, we have enormous differences. I think that's also an important part for the veterinary profession to understand, that these are issues that we do not agree about. Something I get a bit of creeps from Sean when he talks about, oh, we all agree, so it's a bit sort of feely touchy, but I think some of these issues, we should realize that there are different views out there, and I think this issue I'm going to talk about today is certainly an issue where there should be civilized disagreement among nice people. There are 2 sub-questions when it comes to animals that could go on living a good life, an okay life. First, will the animal lose anything? And secondly, when is it acceptable to kill an animal that otherwise could go on living a good, okay life? And I think it's very important to distinguish these 2 questions. The first is about, is there welfare laws in dying? And here, some may be adherents. A lot of animal people tend to be admirers of this ancient philosopher called Epicurus, who said, well, there's nothing problematic about death. If I am, death is not. If death is, I'm not. So why should I fear that which can only exist when I do not? So, that's the Epicurean view. I happen to have the opposite view here. Suppose someone was to kill me now. I'm doing the most fun thing I know in life. And suppose you do it painlessly like the giraffe Marius, I wouldn't notice a thing. And everyone else would be happy. Someone else get my professorship. Oh, that's very nice. But I will still think that you have taken some welfare from me, my potential life. I mean, On a good day, I might hope I can live another 20 years. And I damn want those 20 years. And why couldn't you meaningfully say the same about the animals? And the thing is not about the wanting, it's just sort of, you take something away from them they could otherwise have had. But that's a place where people disagree, and I can really upset welfare researchers. I mean, they start shouting at me when I say killing is a welfare issue. No, it's not. There's no pain there. No, but I'm talking about the future welfare. The other one is, when is it acceptable to kill an animal that otherwise could go on living an okay life? And here, there's the rights view. I'm sorry now for the previous section. I wrote my slides before that. So I'm talking about a thick, non-welfare concept of rights here. I heard what was said before. So a thick, non-welfare concept of rights. Well, no. Animals have a right to life, and that's the most fundamental right. And the other camp will say, well, when the killing is painless and is counterbalanced by concerns of sufficient weight. And that's, of course, where we start disagreeing. What's sufficient weight? Germany has a law banning the killing of animals unless it has a meaningful purpose, vernünftiger Grund. And then it turns out that if German wants a sausage, that's a reasonable reason. So we have these debates, and we should just recognize these will divide us. Then there's the other issue, which is really the issue we're talking about now. That's the euthanasia proper, when an animal must be killed. And just as there can be an issue about killing animals that could go on living okay lives, there can also be an issue about keeping animals going that may be better off dead. And of course, here there's a room for a lot of ethical discussions about what counts as an okay life. And I think if I was allowed to survey you carefully, I think you would divide in a lot of camps and about where to draw that line. So that's why we have this conversation. And of course, there can be interest here. There can be owners who cannot say goodbye to a dear friend. But there can also be economic incentives going both ways. Vets who think it's really nice to, unlike in the medical profession, all specialties, the queues outside, not in the veterinary profession. So if you have some fancy equipment, I would like to try this. It could also be the other way around. In Denmark, a lot of horses are insured, and to get insurance premiums, they want a certificate from a vet saying this was for welfare reason it was being killed, even though probably most of those horses could go on living on a paddock for a long time. So these are the issues, ladies and gentlemen, we're going to discuss. Thank you very much.
Well done. So it's now over to Roxanne and Kelly to present their cases, and there will be little interruptions at points that they will let you know where we would like your input, please. Over to you.
So we're going to start with a quick Slido question, just to start the session. So if you all would mind taking your phones out and answering, do you consider euthanasia to be a welfare concern?
See.
Technical difficulties already. Is it not on there? There's a man shaking his head up there.
It doesn't come up on my phone.
No, it's
No,
not
I don't
started
think it's
yet.
gone up.
I think they might be having a Slido technical
Or we
difficulty.
a hands up one? Should we do a hands up one?
Can I do anything?
Should we go with a yes? A hands up? Should we do a hands up situation? So if you do consider euthanasia to be a welfare concern, pop your hand up. Okay, and if you don't,
Pretty much.
Made my point.
I think we might have a majority unsure.
yeah, there's quite a few people that probably haven't put their hand. It's a hard question,
That was
isn't
pretty
it?
much
So,
sort of
Yeah, that was my
50-50.
yeah, it's not far off. Okay, lovely. Thank you very much for that. So I'm going to introduce the cat that I'm going to be talking about today. So this is Charlie. And at this point, Charlie was around 12 years old at this intervention. And on clinical exam, we definitely recognised some muscle loss in Charlie. There was poor coat condition there, as you can see from that picture. We did put him at a body condition score of 3/9. And on orthopaedic assessment, there was definitely some abnormalities. We had some reduction in motion. There was definite signs of pain when we were manipulating, especially around the hip area. And on diagnostics, we do blood tests and urinalysis, and we put him in Irish stage 2. On talking to the owner did let us know that Charlie had been vomiting every 4 to 5 days, so quite regular, and diarrhea daily. So obviously this was a bit of a concern for us, especially with the weight loss and the muscle loss. But what we did know is the owner did have low funds, and quite obviously a lack of feline knowledge. You know, when you're talking to these clients sometimes, and some of the things they say, and you're like, okay. So we knew that this might be a little bit of a challenge to try and get the owner to understand quality of life with Charlie. So we do complete a quality of life questionnaire every 6 months with each owner, and we did do that with this owner, and we informed him of the results, and Charlie's quality of life was declining at this point. So we discussed this in detail with the owner, and we recommended that Charlie needed some further workup. So Charlie needed to be seen at his original vet. So we don't carry out the intervention at the Feline Healthy Aging Clinic. We see the cat, and then we refer them back to their own vet. So we advise that he sees his own vet, get some pain management on board for Charlie, starts a kidney kind of workup, and try to find out what's going on with those GI signs as well. So that was our first intervention really with Charlie, where we had a really good discussion about quality of life, and we then waited to see him 6 months later.
And to do a bit of a compare and contrast, we also have a horse case. So I'd like to introduce Jay. Jay's a thoroughbred gelding, estimated to be at least 25 years old. He was taken into possession under the Animal Welfare Act and transferred into the care of the RSPCA pending further investigation and prosecution of his owner for animal welfare offences. His initial vet assessment identified multiple issues, including poor body condition, age-related dental issues, and significant musculoskeletal abnormalities. He had reduced flexion through his knees with moderate remodelling of the proximal aspect of his metacarpus. He was very stiff through his hocks, and he wasn't able to cross his hind limbs underneath himself when turning on a tight circle. There was also noted to be remodelling of the cervical vertebrae in his neck. However, he still had reasonable range of movement and could lower his head in order to eat. On dynamic examination, he was generally stiff, but would move into a trot and didn't present with any significant singular limb lamenesses. So the recommendations from the vets at this point was that an appropriate nutrition plan would be put into place consisting of grazing and supplementary mash feeding, and he was also started on analgesia in the form of twice daily oral non-steroidal anti-inflammatories.
So we're going to do another hands-up situation. So if we think about Charlie and what you know about Charlie, would you euthanize now with Charlie? Lovely. And who wouldn't? And who would be completely unsure? Oh, sorry, is that better? I'll get right close. There we go. So that was interesting. That's Charlie. And how about Jay? Would you euthanize Jay now? Yes? Okay, no? And who would be unsure? Okay, interesting. Thank you.
You can say that the unsures have it on both.
Yeah, definitely.
So as a follow-up to that, hopefully we have a Slido that might work, which is, do you use quality of life tools with palliative care and progressive conditions to aid with end-of-life decisions?
You need to be closer to the mic.
I don't think that Slido question's going to work.
Is that one on there? Yeah. Oh, wonderful. There we go.
Is it now working?
Yeah, it works.
Can we get it on the screen, on the main screen? How many? Most people got it on their phones, so they can at least see the result. Yeah. Start.
Can you see the result?
There's still people coming in.
You miss an option. Not relevant. Not applicable.
That's probably most people. Less than half, sometimes, always, only about a third. So, read, mark, learn, and inwardly digest. Do you want to continue?
Yeah, so quality of life tools, I think, can be really valuable. There are some validated quality of life tools out there for cats specifically. There's a really nice literature review. I would definitely advise having a good read of this literature review, because that really does encapsulate a lot of the tools that are disease-specific, health-related quality of life tools as well. So it's a really good one to have a good read through. We use a quality of life tool. We use Vetmetrica, and I think it definitely does help give the owner a visualization of what is actually happening that they're not able to kind of comprehend themselves. So for felines, there's a few out there. There's still not enough, I don't believe, but there's definitely some there. Oh, there we go. We've got the answers now.
Keep going.
And so for horses, there are multiple published welfare assessment and quality of life protocols, but none of these are specifically designed and validated for use with aiding with end-of-life decisions in chronically ill or geriatric horses. So they do still provide some useful assessment criteria and approaches, but the main limitations identified with most of them in assessing quality of life for end-of-life decisions are their failure to sufficiently prioritise the subjective mental state of the horse over time, and a lack of appropriate integration of the assessment criteria into one overall grade to help with decision making. Of the options currently available, it's been suggested that the 5 domains model likely provides one of the better conceptual frameworks for assessing quality of life, where it's defined as the horse's evaluation of their own life. But there are still challenges with applying this framework as a quality of life assessment tool in practice. And at the RSPCA, we routinely use a welfare assessment tool based on the 5 domains model called the Practical Welfare Assessment Matrix that's been developed internally but is not yet validated. All horses are assessed repeatedly throughout their stay with the RSPCA by their care teams, and these assessments inform the decisions and approaches to their individual rehabilitation. And we'll see Jay's assessments as we progress through the case as well.
I think that's quite a good question as well that's up there, and I think something we do need to think about is actually validation necessary for general practice. There is validated tools, we do talk about validation, but when it comes to practice, I think the biggest thing that we want owners to be doing is to be thinking about everything. And these quality of life tools are really good for considering emotional well-being, vitality, the comfort of the animal, and I think without these tools it's hard to get that across to an owner. I think sometimes we struggle to communicate that to them effectively, and the tools that we have there can be really helpful. But again, it doesn't necessarily have to be something that's written down, questions. Even just going through the process of some tools that you've seen and talking to them with the owner can almost kind of open up that thought process to them. So personally, validated tools are fantastic, and it's really important that they're there. But if we just have something that we do use in practice to open up that mind of the owner, it can make a really big difference to that decision making and everything involved that kind of surrounds that decision making, the anticipatory grief and all that kind of thing that comes to it. I don't know if you have any other opinions on quality of life tools, validation and that kind of thing.
Yeah, I think I agree. I think they provide a really useful framework for having structured discussions with other members of the care team, including the owners as well. I do think when we're using non-validated tools, we do need to be careful about the interpretation of the results that we see as well, and understanding the limitations of when we aren't using validated tools, particularly if we're using them to help make informed euthanasia and cut-off decisions as well. But yeah, and I guess there's other issues around using these kind of tools and making these decisions and how we assess quality of life in another individual is some of the limitations around proxy reporting that we know that exists, that we will always be using ourselves as veterinary surgeons or clients as observer reporters, as opposed to being able to ask the patient directly themselves.
Do you have many owners that have had the process of quality of life tools with when they come to you? Is it something that is often brought up, or is it something that you think is missing quite a lot?
Well, their knowledge of of what's accessible in this decision-making process is usually quite limited. For that reason, for the hundreds of calls we get every week, we have a very basic quality of life tool on our website, because there are a number of frameworks out there, more or less complex, that definitely appeals to different levels of understanding amongst the users. But the one we have on our website, which is hugely helpful to those people who like to be a little bit more, taken by the hand, to see things in writing, to make this awful decision that they're toiling with. And some will bring it up, and some will just be talking, and we will know where it kind of fits in the scoring process. But it's certainly a very useful way to deal with a very explosive topic and very highly emotive. It's good to have something maybe a little bit firmer in those events there. So.
Any thoughts?
That's extremely helpful. So if you're happy to move on to the next stage.
Absolutely. So we're going to come back to Charlie now. So this is 6 months later with Charlie. I'm sure you can see from the picture there that there's been a decline in his health. So we've now got severe muscle loss and weight loss. The body condition score has dropped to a 2, and there's obvious signs of pain when Charlie's moving around the room, trying to get out of the carrier, very stiff. But the owner states that Charlie is still eating and enjoys her life. So I think this is something we hear quite a lot from owners, isn't it? Oh, they're still eating, so they're fine. Or, oh, it's just old age, it's what happens. And they're educating the owners around this kind of feline behaviour and their drive to eat and why they do still eat, even though they are feeling actually pretty naff, is really important. And when you do explain it to the owners, they quite often have a little bit of a light bulb moment, and they're like, oh, okay, actually, this is something I need to think about a little bit more. But Charlie was really stiff when getting up from resting at home as well, and the owner reported that it was a lot more irritable with the other cat, which is something new that had started. So I was aware that obviously at home Charlie was struggling too. So I completed the questionnaire with the owner again, went through the quality of life questionnaire. The owner wasn't that tech savvy, so I did go through it with him. And I did notice that he was actually answering the questions more in favour for Charlie than what I would have done. But obviously I don't know the pet. We put it down to the owner knowing the pet best. But I do think there were some questions that he did answer that were definitely more in Charlie's favour than not. So it's an interesting consideration, I think, when we think about quality of life tools, is that sometimes there is a sense of denial there, and I have to think about that a little bit when we're doing these assessments. So the recommendation at this point for Charlie was to discuss the behaviour in relation to the poor quality of life and try and get the owner to understand that we were going to advise euthanasia at this point, obviously being aware that the owner hadn't been able to do any intervention, hadn't been able to get any pain management on board, potentially low funds, that kind of thing. So at this point, we advised euthanasia for Charlie.
And if we move on to Jay's second intervention, we can see from his welfare assessments on the slide that the initial interventions did appear to improve his welfare and overall quality of life. However, this assessment done 6 months later does indicate that there might have been a recent decline in his overall quality of life. And at this point, he was still on long-term maintenance doses of non-steroidal anti-inflammatories, of 1 sachet of Danilon twice a day. And on his physical examination, he was described as hesitant and generally stiff, but his body condition score had improved. The specific comments by the grooms during his welfare assessment was that he seemed to be struggling with activities of daily life due to his arthritis, and he very much disliked the summer heat. So the recommendation from the attending vet was to consider humane euthanasia at this stage, but the legal case was ongoing and the owner was non-compliant when asked for consent. So the decision was made to increase Jay's analgesia further and monitor the response over time.
So we're back again, hands up time. Who would euthanize Charlie now?
Quite a shift there.
Yeah, and who wouldn't? Okay, and who's unsure? Okay, and how about Jay? Would you euthanize Jay now? Yeah, who wouldn't? And who's still unsure? Okay, interesting. Thank you.
So I think this brings an interesting discussion about where on the scale we do draw the line with chronic degenerative conditions, because even when we're using quality of life assessment tools, they give us information about the experience of the animal, but they don't actually tell us where the right time to euthanize or make that decision is. So we just want you to consider really when quality of life is a continuum about where on the line we would make a euthanasia decision.
Where would you?
Well, I think particularly for chronic degenerative conditions, we need to bear in mind that unless there's an intervention that we haven't yet tried, that moment in time is likely the best quality of life that animal's likely to have for its future. So personally for me, with those kind of situations, once they start to get to neutral, then I start to consider whether or not there's anything we can do realistically that's going to provide a life worth living at any point in that animal's future, or whether it's just going to be a decline until we make a euthanasia decision from that point. How about you?
I agree. I think when we're coming to the neutral, if there's no aspect of a life worth living, then you're taking that animal's lost a lot of its all different aspects, its emotional well-being, its physical well-being. If there's nothing there that's kind of giving it a positive aspect, then I feel like it's not, why should that animal still be, in that situation? It is a very interesting one though, isn't it? And it's a tricky one. I'd love to hear Peter's thoughts on the scale.
The problem, of course, is that it's not an absolute scale. And a lot of, if you talk about the human case, I've been doing medical ethics when I was younger, a lot of people would say, well, I have chronic pain, but I still enjoy my life. And I'm still eating, but also, my neighbor I live in the countryside, my neighbor has some horses, has had some horses, and they used to be, gray and like this. People kept on calling the police, but in essence, they actually could also adjust. So often animals can adjust like we can. So I think there's a big issue about sort of also, you have some chronic, but if you're able to adjust and adapt and go down in sort of speed, at least for dogs, which I know much better than horses, I would say, and cats, probably I'm much more uncertain about it. And I think that's one of the areas where, if we compare with the human condition, it's so difficult to draw that line, because it looks like it's an absolute, we have red and green, but in reality it's just a sort of continuous scale where we ourselves have to decide what's red and green. In that way, I think it's cheating a bit, because we can sort of describe on a scale the level of disease, but where to draw the line is an ethical decision, and just by drawing it that way, it's a bit manipulative, I would say.
And I'm with everybody in the room that were unsure, because I think that's a very good position to have when we're dealing with families and members of the public who have these animals, because they're always unsure, more or less, unless they have a situation where it's very clear. In my experience, having dealt and helped personally over 15,000 families in this situation, I know it certainly is a very gray area. And I always say there is no right time for euthanasia, but there is a best time. And the best time is when everybody in the room agrees that this is the best time, and the animal is in what I call in its window of opportunity for either more palliation or for euthanasia. But unless there is a partnership going on between the family and the vet, then I would say it's hard to say that it's the right time, because it needs to be a two-way street. And that's what we spend many hours, sometimes we spend several hours with families trying to sort out the dynamics and have everybody on the same page, because there's no doubt that the animal is at that stage when they're in that window. It's just really, we need the consensus so everybody is helped, because the suffering and the pain is two-sided. It's the animal side and the human side. And we want to leave them with the best possible experience and memory, so they go back and have new animals from a positive endpoint, so to speak. And I think that's the partnership that's important.
With the quality of life assessment, it seems that there is the potential for making a decision beforehand at which point euthanasia, you cross a line. Do you use them in this way? Or is it simply as a way of seeing deterioration. I'm saying that you sort of need a cutting off point that says beyond which I will not go.
Yeah, so we don't, but I do think it can be quite a useful concept to discuss, particularly with clients and decision makers ahead of time, that takes into consideration the important aspects of that individual's life. So with caregivers that really know their animals very well, they'll understand what really are the important points about providing a good quality of life, which will vary between individuals, which can then be taken into consideration for making decisions.
Well, I have a rather strong view here. I think these tools are great if they're seen as decision support tools. I mean, if they're going to be tools taking decisions, I think in a way you're cheating yourself and people, because at the end of the day, there must be a personal judgment involved. I think these tools are really good to alert people to aspects that they wouldn't see otherwise, so it helps to see things. But at the end of the day, I think giving the decision to a tool is in a way cheating yourself and pretending that there's some objective answer to something for which there will always only be a personal answer.
Right. Move on.
Okay, so third intervention for little Charlie, who again is looking even worse than the last time we saw Charlie. As you can see from that chart up the top there, that's the quality of life results that we've had coming in for Charlie. Have I got a little laser on it? So the first intervention result was here. So we can already see at the first intervention that the quality of life is declining for Charlie. So at this point, we really didn't do much of an exam, really, with Charlie, because we saw that there was a lot of pain there. We didn't want to be manipulating Charlie to the point it was unnecessary. Dropped another body condition score, really severe muscle loss, and the kidney disease had progressed. Charlie wasn't on any kind of kidney diet or any intervention at all for the kidney disease. We repeated the quality of life with the owner and discussed the results even more in this sense. And that's when the owner started to open up a little bit more and explain that Charlie could no longer get out of bed easily and needed a lot of encouragement to eat. And you could tell that he was starting to actually realise that it was the right time for Charlie himself. So again, we left the owner with Charlie and advised that Charlie needs to make that decision for Charlie. And 2 weeks later, I kept an eye on the clinical records, and Charlie was put to sleep 2 weeks later. And despite the kind of quality of life conversations and the education that we did do, I personally kind of felt that the owner still didn't euthanize until they were really ready. And I was a little bit concerned. I was keeping an eye on the clinical notes, and I was thinking, if Charlie hadn't been put to sleep within the next 4 weeks, what would I do as a veterinary nurse in this situation, where I feel that this is a serious welfare concern now for Charlie? How would I go about the next steps of what to do? And thankfully, I didn't have to make that decision, but I think that's something we definitely is important to discuss as we get into more discussion in this session, because I was quite concerned. But yeah, Charlie was euthanized 2 weeks later.
And our third intervention with Jay showed that the increased analgesia previously prescribed had prevented any further immediate decline, but it didn't improve Jay's overall quality of life assessment. And after only a couple of months, a re-examination was requested due to concerns about further decline in his condition. The grooms were concerned that he was now frequently stumbling very badly when being led, to the point where sometimes he would almost fall down, and they'd not seen him lying down resting for some time. He was also spending significant periods of time just standing in the field shelter alone now and not interacting with his other field companions. On his physical examination, he was generally stiff, with advanced osteoarthritic changes evident in his neck and limbs. He also had a significant facial grimace throughout the examination, and there were concerns about his ability to lie down and achieve REM sleep. So further analgesia was provided using additional medications, and the vet certified the need for euthanasia based on welfare grounds, regardless of the owner's willingness to consent now. The owner was informed and given the opportunity to have their own veterinary assessment performed, which they did. The owner's vet examined him and agreed that Jay did have advanced osteoarthritis, but disagreed that euthanasia was required at the time if the owner was not prepared to consent. At this point, a third veterinary opinion was sought, and it was agreed that Jay did have a poor quality of life, and euthanasia was in his own best interest to alleviate and prevent further suffering. So euthanasia was performed using Section 18.3 of the Animal Welfare Act at this point.
So hopefully we do have another poll here. So we'd like you to answer, at what point did you consider the euthanasia for Charlie? We'll see if we get the results on our screens.
Can we have the results? I've got them. Aha, there you go. Do you want to comment?
Yeah, interesting. I do wonder if I didn't put we advise euthanasia, if the intervention 2 would be similar. But yeah, intervention 1, it's a really good point, because at that point of intervention 1, we knew that Charlie's owner had no funds. We knew that, you know, Charlie's owner may struggle to do the interventions that were needed, and I think it's really important to think about that and think about the contextualized care involved in these patients, where we're not just looking at the physical health of the patient, we're thinking about the aspects of the care for the patient, we're thinking about the emotional health of them. So it's important to take that whole big picture into these decisions. So interesting. And how about Jay, I think should be the next one, yeah. At what point did you consider euthanasia for Jay?
Very similar.
I wonder if we'd made 4 interventions, whether would have been more difficult to pick the intermediary.
Would somebody like to comment on the very small percentage, but there's some nevers here?
I was quite interested, because I think that might be Christiane up there that's representing animal hospice, but I know her well enough, it's not. But animal hospice is something that I've been trained with, which some of you may be familiar with or not. It's not a brick building, it's a philosophy of care, where we actually will palliate till the very end, or almost not the bitter end, that's the difference. But we will, and I have got quite a few American colleagues which we have met at the International Association of Animal Hospice that do never support euthanasia. So that is also a stance that does exist, because the belief is that we can palliate like we do humans sufficiently to a natural death. So that is a viewpoint for sure, whereas personally I do feel we have euthanasia and it's a gift.
I would argue about please comment on the natural death, because if you're thinking about the animal's welfare, you're presumably providing some form of support, pain relief, etc. Is that natural?
Well, we have a lot of people who say that they would have preferred that, because who wouldn't want to not make the decision that the animal has made the decision and not woken up the next day. If I had a penny for all the clients that said that, I said yes, but I don't think that would be in anybody's interest if it's not supported by pain relief, palliative care like we do people, and then they kind of realize that's probably true. And but yeah, that would be a blessing for the lucky that do not wake up, that we wouldn't have this discussion in here today if that was more common.
I just feel like making a comment. I know it's very irritating, someone coming from abroad and telling about their own legislation, but I think in Britain it's okay. It normally goes the other way. In Denmark, a vet will actually be legally obliged to intervene if they feel that the animal is treated improperly. And not even to the point that the vet can be punished for not doing it. Normally it's not the case that if I see someone speeding, I don't have an obligation to call the police. But in our system, the vet actually has a positive legal duty. And I think that can be a big help. It doesn't solve all the problems, because we have all the real life problems, of course. But it can be an enormous help for the vet to say, sorry, I understand your view, but you must understand that I have a law that tells me if I don't intervene, I must call the police. So it's a way for the vets to avoiding having to postpone endlessly. So I know you don't like to be preached from Europe, but still, I think it could be something worth considering, having some sort of a mandate, an obligation as a vet, which means that you will have a lever, something you can use to motivate clients to take the necessary steps.
Thank you.
Now, I just want to come back on that point, because, I mean, how does it reflect on the profession if we have a legal requirement to do this as opposed to a professional obligation and a moral duty when we're there to protect animal welfare? So do we require a law to do this, or should it be a professional obligation anyway?
Comment?
Well, ethics is sometimes poor man's law. I mean, sometimes law is a big help. It doesn't take away the decisions, it doesn't take away all the ambiguities, but it at least gives you this feeling, okay, I have a mandate from society to draw a line, which I think would be a big help. So I'm not saying you should not be professional, not have ethics, but you will have some help from the law to draw a line.
Almost takes away that decision making a little bit, doesn't it, by having that assistance? But then we do have a law, kind of.
Yeah, and we do have one more question, which I think leads on nicely to this, really, which is at what stage in these cases would you consider it appropriate to prioritise animal welfare over owner consent?
If I may make a small comment, together with Sandra Kaur, who is also in the room, we did a survey also in the United Kingdom about vets' ethical attitudes. And it turned out that they come in different groups, but I'll just take two of them. One is more client-centered, one is more patient-centered. And I think this nicely reflects that in a room full of vets, they all care about animals, they all care about clients, but some will put more emphasis on client autonomy. Others would put more emphasis on their patients. So I think it reflects the reality of the profession. Even though you all have shared values, the priority you give to these values are not the same, which is also an important thing to remember in these discussions.
Good point, thank you. Well, now Peter will present his two cases. You're going to go.
Yeah, and it goes against my nature to speak sitting, so I'll just get the thing here, Oh, I'm just waiting for this to come up. I'm going to present cases which are different in the way that they're about behavior problems. I'm not a vet, as you probably noticed, but I have good friends in the veterinary profession, and the cases both come from a Danish vet called Pernille Hansen, who works as 50% of her practice is behavior cases. So she kindly gave those cases to be used here. The first case is about Pluto. It's a small mixed breed, Coton-Toular Bichon type. The small thing is about, we're going to talk about aggression in a moment, but this one is not going to kill anyone. It's a castrated male, 1.5 years old, when the case starts. Pernille, specialized in clinical behavior medicine, was called out by the female owner. She was in mid-20s and lived in her own flat in the inner city. The reason for the contact was that the dog was reactive to strangers and other dogs, also showed clear signs of fear and anxiety during most walks on the street, tail down, hectic movements, only sniffing briefly, all the time scanning the surroundings. This gave rise to fear and anxiety for the owner. She could not stop and talk to friends and acquaintances on the street, and she found it very difficult to have guests. For a start, the dog was outward reacting against other dogs and also towards humans, including guests in the home. The dog also caused trouble at a visit at the owner's parents' home and also showed signs of fear when taken for walks in the countryside where the parents lived. The dog only seemed happy when alone with the owner in flat or early morning in park. There were both good and bad days. Basically, the dog was only happy for short stretches of time. The veterinarian made her first visit after the dog began reacting to other dogs. She started behavior treatment. The dog became better for 3 to 4 months. At a second visit, the dog's problems had increased. She tried medication, Reconcile, pregabalin, I don't know if you call the same in England, was also tried after a second visit. Dog got better between contacts, but soon problems reappeared. The total period of treatment was 8 months, in total 3 visits and 6 telephone calls. At the second visit, the owner herself brought up the issue of euthanasia as a solution. And there was an increasing expressed motivation in owner for euthanasia. So the question I'm going to ask you is, what should the vet do? Should the vet support the owner's wish for euthanasia? Should she push for more treatment? Or should she seek a new home for the dog? I can still see there are a few more in the room who haven't made up their mind. If it wasn't appropriate, I would say I love you, because you make my point about the diversity of views. And which of course is that, okay, there is no simple solution, and you are divided on this. I guess if I had done the same in Denmark, we did the same in Denmark, it would have been different. I mean, I said we are Nordic noir, so there would be more on the killing side, but still we had the divisions, but with different numbers. The dog was eventually euthanized, and the dog owner seemed very relieved. So there was a dead dog and a happy owner. Okay, sorry for that one. Okay, I go on to the second case, Chana. That's a bigger dog. That's a Bernese mountain dog. That also has a role here. It's not aggressive, but there's some other problems. Same, Pernille. She's called out by the owner, who's a middle-aged woman who used to hold high positions and who, as a person, was very much in control. However, she has suffered a stroke a few years earlier and therefore is not fully in control of the movement, so she actually has difficulties moving around. She lives in a house with a garden in the middle of a larger town. The reason of the contact is that the dog suffers from fear of traffic, is also unwilling to enter the owner's car, and is afraid of driving, and therefore it's not possible for the owner to take the dog for the countryside. The owner is afraid of walking the dog in town because she fears she will fall over when the dog tries to get away from traffic. At the first meeting, the owner starts crying and says to the veterinarian, "The only thing you may not tell me is that I cannot have the dog." The veterinarian is for a start worried about the prospect and thinks that either euthanasia or relocation to a home in the countryside may be the only realistic outcome. So, my question for you is, should the veterinarian voice her worries and bring up the possibility of euthanasia or replacement? Or should she just follow the wishes of the owner and embark on treatment? So, so should she bring up this, or should she just embark on treatment? Do what she was being asked to do by the client? Interesting.
It's most of them.
Still, again, you're divided. The majority thinks you should suggest replacement, which, by the way, was against the wish of the owner. So you didn't follow the owner, so you anti-kill, but also anti-owners. Okay. Pardon? What? Yeah, but she didn't, didn't come up, so sorry, that's... You can always change the story. But it actually had a very different ending, this one. The dog was given medicine to limit fear, and behavior therapy was undertaken. After consultation every other month for a year, the dog was less fearful, was off the medicine, could get into the car, and could be driven without problems. And the owner now regularly takes the dogs to a forest for walks without problems. So that was a case where the veterinarian, and a lot of you, grossly underestimated the willpower of that woman. So what did the trick and broke the vicious circle of a fearful dog with a nervous owner was that the contact between the dog and owner improved, and the owner gradually felt more confident that she, in critical situations, could be in control and via good relations to the dog. So there can be resources even in difficult situations with the right kind of owners. So I think we can see from those cases that behavior cases can be difficult. There can be real issues, both of human safety, about dog welfare, and I think also fair to say, compared to the previous cases, as soon as we go into behavior medicine, the majority are very reluctant to use the E word. Very reluctant to suggest euthanasia. I happen to think that this is probably partly because that the veterinary profession sort of has a sort of hands-off about behavior. I mean, in most cases, I don't know about England, but in Denmark, we have a vet school. It's a bit like a medical school without psychiatry. We don't have clinical behavior. Do you have that in any vet schools? You have it in Edinburgh, no, but most vet schools don't have it, I think. So a lot of vets are trained without clinical behavior. And I think in reality, psychiatric diseases can be just as severe, but there's a big area that still needs to be pursued. Okay, these were the words.
Can I get a quick comment from the panel on these last cases, and then we will throw it open to the full discussion. Perhaps I can pose a question. I personally feel that when there's a behavioural problem, that rehoming the animal is abdicating responsibility. Comments?
Yeah, I agree. I think the decisions or the impact of both decisions to either to euthanize or not euthanize needs to be fully considered from the welfare impact of the animal and the people involved too. Rehoming animals with significant behavioural concerns can present significant owner burden for the future carer, as well as really compromising the welfare of the animal too. Rehoming is a massively stressful experience if they're already struggling psychologically and or physically. Is that the right thing to do for that animal? So I agree. I think rehoming needs to be incredibly well considered if it's going to be successful. And I talk from personal experience of having a pre-loved border collie at the moment who's currently ruling my life. So.
Yeah, I think I agree. I think you have to make sure that the reason the behaviour is there and the reason that you're having these problems, if it can definitely then be resolved in the new home. I think I'm thinking from a cat point of view, you know, you might have a cat that's really, really stressed in the home because there's cats outside that it can see out the window and it's getting really, really, really stressed and it's inappropriate urination, it's a burden for the owner. But you might find a home for this cat where it's a house in the middle of nowhere. But if you can, as long as you can pinpoint that behaviour and know that that behaviour is not going to be an impact for the next owner, as you say, with your little puppy, I think it's important to consider that. It's not just as easy as saying, oh yeah, no, it needs a new home. Let's try this place. It does need a lot of consideration, definitely. But I think there's behaviourists this afternoon that will probably give us a good answer on that one too.
Well, I think we all know that behavioural problems is a can of worms, and that's not just the animals. So I would say Peter's cases to me highlights the cultural differences between Denmark and England very, very clearly, and we had this discussion prior to today as well. I'm Danish as well, but I've been here to 22 years, and I can tell that the cultural differences between the attitudes to rehoming and euthanasia was highlighted in Peter's cases, because I think both those cases would never really have euthanasia as an option. Certainly not in the first instance would that be discussed, because they both are so young and they are obviously just, well, in my opinion, placed with the wrong family or the wrong circumstances. And that's the approach that you beautiful British people, most of you, the reason why I've been here 22 years is because you have a far more heart-based approach to the love of animals than in Denmark, where we obviously kill giraffes and other sentient, innocent animals far more readily. But that's another discussion, but that's because we do not have all the wonderful rescue organizations in Denmark that you have over here. And that is the reason why I'm still here, because I love the attitudes that are much different, and including this panel here today shows the interest of actually looking towards the animals' best interests more than maybe suiting the owner, who probably shouldn't have had a Bernese Mountain Dog a year after having a stroke. I mean, come on. I don't know.
Should we do it? Thank you very much for all these presentations. So we'll do that a bit first. And this is now open to discussion, so you can put your hand up and look for the person with the microphone, and there will also be some on Slido. I'm going to start with one that's on Slido while the microphones are moving about. Do some owners wait to be told it's the right time, that it's actually a relief to them when the vet team clearly advises PTS and the decision is out of their hands? Susan?
Sorry, I thought you were posing a question to the...
Shall I go again?
Somebody else?
Do some owners wait to be told it's the right time?
I mean, I'm not a vet, but we did a study where one question that annoys half of the Danish vets is clients asking, what would you do if it was your dog? And then some say, no, it's not my dog. Others actually quite like it, but I think owners generally, at least where I come from, are very keen to get advice. So I think more often than not, they're really willing to listen. So this being afraid of actually engaging a dialogue, I think is a mistake. You should have an open dialogue right from the start, not in a moralistic way, but say open for the opportunity to voice these concerns is, I think, a very important issue.
I agree, yeah. I think we shouldn't be afraid to answer that question when owners go, what would you do? You know, don't be like, oh, well, yeah, it's your dog, you know, it's your decision. I think it's fine to open up and show yourself a little bit with them as well. It helps that connection, I think, sometimes as well. So yeah, don't be afraid to be completely honest with them and give them your point of view as well, I think is important.
Well, as I said before, it's certainly a partnership. It's really what the limitations in practice is often the fact that it's clinic-based and having an actual discussion about these things in a 10, 15-minute consult is really difficult, even with various frameworks and other things, because it's so highly emotive. And I think the time to have the necessary discussions, certainly prior to making a decision, is what's really important, and that is in clinics not really possible, which is why I personally believe that the end of life in many instances should not be linked with clinics as such, just like we did in the NHS in the 60s in this country, separated out the end of life care to hospice care, and realized it is actually the last stage of life. It's entirely own requirements for time and care, and it's never, at that time of life is really when clients and animals needs the most attention and the most time to make a decision that they can live with. And that's how I say that's usually the best time, is to make the decision that you can live with and find out what that is, and then make sure that the animal is also comfortable, which is much more possible than what we actually currently apply from clinics, because sending a dog home with a tub of Rimadyl is not palliative care. Palliative care is so much more, and animal hospice is also remembering to take care of the family side of things. That it is 25% is comfort care for the animal, 75% when it comes to the end of life is actually getting that consensus from the family while making sure that the animal welfare is not compromised. And that can take time. And having that time in clinic is just not possible, which is why luckily services like my own has been mushrooming all over the country, much to my joy, because I started out in Sussex in 2005, seeing that there definitely was a need there was not being met. And besides, I do like having flowers and chocolate as well.
In this day and age of a lot of technology and clever treatments, have we got worse at actually offering euthanasia as a perfectly viable option for the welfare of this animal?
In my opinion, having obviously, sort of say, market research with the many, many thousands of families I've had time to speak to, I find they are being pushed in two directions only, and that is either the hugely intervention-based approach, or it's like, well, yes, you can do all these things, or you can also have euthanasia if it is even mentioned. Sometimes it's not even given as an option when it should be and be discussed. And instead of thinking, well, there are more options than two, because there is a window in between the intervention and the euthanasia. That's called palliative care. And that means also making the owners, the families ready to let go. And that is really what the palliation is all about.
I'm going to do one. We'll have one from the floor. Have we got a microphone somewhere?
I have a question.
There's a microphone. Okay.
Hi, I'm Laura. I'm from the University of Bristol. I have a question about horses, so it could be for Roxanne, but it actually encompasses a lot of what you've discussed, so it could be for the whole panel. Relating to the BVA's list of priority welfare concerns, including things such as limited turnout in horses, how do you go about applying the quality of life tools in substandard conditions, such as having limited turnout, especially relating back to what Sean said earlier with the veterinary profession not having policy statements on certain aspects of animal management? Does that make sense? You know, when you have what the owner might view as them living in an ideal life, you personally may feel that, you know, using the whip, for example, or the way they're treated is not conducive to high quality of life. How do you go about that as a vet?
Well, that's a big question, isn't it? So I think broadly, and this applies to all species, one of the biggest limitations of making any assessments is the level of knowledge and understanding of the assessors involved, which I think is particularly, well, I think it's relevant for all species, but for prey species where identification of some of the signs of compromised welfare can be more difficult to identify or more subtle, and we're maybe not culturally so aware of them, then they can be a real challenge. But those do impact. So meeting the ecological needs obviously impacts very much on quality of life and their ability to cope with any other adversity as well. So it is really important that we take that into consideration and the impact that that has on the individual that we're looking at the time. I don't know if you've got any thoughts from cats.
You're looking at me for a comment. I was just thinking as you're answering that question then, I think we need to talk about it maybe even earlier as well, the quality of life, the animal welfare, talking to our owners, explaining what is good quality of life, what's poor quality of life, what our kind of responsibilities are as an owner, because the owner is responsible for that pet. And I do wonder if we need to talk about it in general more often and not wait for the point where we're worried about the quality of life of the cat. Do we need to educate a bit better from the very beginning so that these owners are almost, they've got it in the back of their mind already, and when we start having this conversation about quality of life when the pet is becoming unwell, is that the right time to maybe discuss it? I don't know. I think maybe we need to educate a bit further back, potentially.
Thank you. Peter's got a question.
No, that just relates back to the previous question about advanced treatment. The study I did with Sandra Kaur comparing Denmark and UK came up with one surprising finding. People asked, do you think dogs and cats have similar treatment that we give to humans? In UK, 70% answered yes. In Denmark, 30%. So there's also something about the UK audience, which probably expects advanced treatment. So there's a completely different sort of way of thinking of animals over here.
I've got a question back on that, Peter, which is, why do you think that is? Do you think this is a different in assessment of impact of these advanced treatments?
The main explanation is probably that you got urbanized 200 years earlier.
Insurance?
Insurance not, no. In Denmark we have an insurance rate of 70%. In UK it's smaller. No, it doesn't. It's not explained by insurance at all, no.
Okay. Let's have another question from the floor. Where's the microphone? There's a microphone over there.
Hi, I'm Caroline Allen from the RSPCA. I thought it was a really interesting contrast between Kelly's case, where Charlie was euthanized, quite a few weeks after the advice had been given, to the RSPCA situation where there was the use of the legislation, so the Animal Welfare Act. So my question to the panel is, does the profession have a good enough understanding of the Animal Welfare Act? Are we really following our professional code with regard to, ensuring that animal welfare is first, and understanding that it is unlawful to allow animals to suffer unnecessarily, and that is not just physical suffering, it is also mental suffering. So is that awareness there?
Roxanne?
I think probably on the whole that there isn't a good enough support framework for vets to feel confident in really making positive action in these scenarios. I think they're really complicated situations involving lots of different factors that need to be considered, including the client. But I might be interested to hear from Kelly's point of view of what considerations you were making if the owner didn't euthanize Charlie.
Yeah, I think your point about do we understand the Animal Welfare Act enough? And I would say no, I don't think we do. And I think when it came to the point of I was starting to get worried, and I'm going to have to take some action here, but then as a veterinary nurse, can I do that? Do I have that kind of role? I would need a veterinary surgeon. Would I need a veterinary surgeon? These are questions that were going through my head. Would I need a veterinary surgeon to support that decision? Technically, no, depending on the expert of that person who is putting that forward when it comes to going over the owner and taking legal action. I think there is a lot of fear around it. I was worried what would be the implications, if this pet wasn't put to sleep. we as veterinary nurses play a massive role, I think, in supporting owners and educating owners. And sometimes you can't do it with them all, but I do think we have a little bit maybe more time. Owners tend to open up to us a little bit more. I think it's really important that we use a team approach when it comes to these scenarios, and we discuss with the whole team and make sure that everybody is on board and on the same kind of level, because I think it's hard for me to say really, because within the project I'm in, it's myself and a vet. If you're in a big practice, I think it's important that everyone is on that same level and everyone has a deep understanding of it and what to do, because I can imagine it can put people in turmoil really when you're thinking about what's next. So I do agree that we do need to understand everything better, definitely.
There's a linked question here on Slido. Although there needs to be a two-way discussion, ultimately, is it not our role as veterinary professionals to advise owners and advocate on the animal's behalf?
That's definitely the foundation of that, and I have to go back to animal hospice to say that, or the palliative care side of things, that there will never be, the comfort of the animal should never be compromised, and there's many ways to attain that while you're having these discussions with the owners, so they're also seeing where we're coming from, and that's where the discussion has to be two ways. It has to be a compassionate conversation where you understand that everybody's got their own interpretation of what's a happy animal, what's welfare. The public has their opinion. Yes, we have our professional opinion, but my guiding principle is always how do I actually want this to end? And then I see that this end result is really that I want the owner to be, or the person who loves, or the people who love this animal to be on board with seeing that it's the loving thing to do is actually to not let the animal suffer. And what does that look like? And in the many, many years I've done this, I've never had to take any legal action with anybody, as long as there's enough time to talk about what this looks like. And I think it's really a sign of failure to have to go out there with a piece of legislation and put that on the table instead of having a discussion. I think everybody wants to do the right thing if they only are shown or taught or educated in a way to understand what that looks like. And that's our job.
Yeah, I just say I think it's a very value-laden question. We know, as I said, that there's a difference between vets, how much they emphasize the duties to the client versus the duties to the patient. But I also think there's a different discussion about what's the right strategy. Will you better help the patient by actually be more forthcoming to the client, or would a more confrontational style work? So I think there are really two discussions: the strategic discussion, which way of dealing with clients works. Secondly, your relative role, client versus patient, within certain limits.
There's a Slido question which has disappeared, but which I felt was extremely pertinent. Along the lines of, is palliative care ever for the benefit of the animal, or is it always for the owner? Susan?
There's a bit of only two options there. I like more options than that. But generally, I'm an option person. I believe that palliative care is in everybody's interest, because palliative care is looking after everybody's needs and not compromising anyone's needs. It's just what it takes to get there. And I think it is really just needs to be a balance. And attaining that balance, yes, that can be difficult.
Thank you.
Surprisingly, I'm going to side with Susan, because I think if the end would be that she could only treat treatable diseases, but take something like chemotherapy. That's done to keep the cancer in bounds until you euthanize. So a lot of therapy is done not for the sake of curing the animal, but keeping it going. And I would say, as long as the animal is happy and you can testify it works, what's the big deal? Otherwise, you would take away a huge part of what vets already do.
Sorry, can I just follow up with Susan about this? And I think, do you think that some of these issues arise from the use of the term palliative care, and how we think about that in human medicine compared to how we utilise that in animal medicine?
Yeah, there's definitely, as usual, there's a conflict as to who puts what meaning into what terms, because a lot of people will say, oh, well, he's on palliative care, which just means, yes, he has extra food at night. If that's one extreme, and the other is obviously having 8 different drugs at 8 different times, and it's a very, it really depends on what you call what sort of care, I'd say. But it's always worth knowing that the owners wants to do best. I mean, I think that's a good starting point to say the owners or the families generally want to love their animal, and they want to do best. They just sometimes need to be shown what that means and what that entails, or how far do they go. And what they call it, well, I would say it's concentrating all that love at the very end and giving time to do that is important sometimes, rather than intervening and threatening and saying, and this has to happen right now. Because this, I always say, the animal is not really expecting anybody to do anything. They've been kind of growing into this chronic chronic condition over time. So like at the weekend I had a severely dyspneic 18-year-old cat that was lying there gasping for air, but had been for several days before I got called out. So, and the owner, who was herself, it showed up, severely traumatized from childhood, and couldn't even tolerate me putting my arm on her, my hand on her elbow, because she was just so she needed to tell me her life story for 3 hours before we euthanized the cat, which is something I couldn't have done 10 years from now, before, because I would have thought, I need to help this animal right now. She's clearly suffering and can't breathe, but was quite peaceful with that. So I decided to take the peaceful approach and let her tell me her traumatic life story of her 60 years of trauma before actually helping her say goodbye to her cat that she had as her only consoling point in her life. And at that point, after she had kind of shared her life story with me, she was ready to let this cat go. But that was prior to the 5 phone calls I had the same day about this. She was severely traumatized about making this decision. And if I'd rushed in there and said, oh, well, this cat really needs to be put to sleep because it's suffering, because it was suffering. But how long does it suffer for who needs to suffer here? Was weighing it up against each other to say whose needs are more important. I think the cat will be all right. It's kind of peaceful in its bed, gasping for air, like it has been for a couple of days. So those extra hours there, we just made a peaceful situation out of all of it. So that was just a little example.
Thank you. Now, we're running out of time. I'm going to finish by asking each of the panel members 30 seconds max on, is it better a day too early than a day too late? Do you want to go, Susan? 30 seconds.
Yes, I would say that's a very good saying that a lot of people cite when they make this decision and they see us. I have, however, rewritten it over the many years I've done this too. From the owner's perspective, it's always too early, until from the animal's perspective, it's too late. Because most people regret, and they call us back the week after saying they wish they'd done this the week before, if they'd known then what they know now.
Thank you. Kelly?
I'll make it quick. I'd rather be day too early.
Perfect.
That was quick.
In terms of
I'll give Peter Kelly's extra time, so I'll be brief as well. I'm probably also a day too early person, but I think realistically what we need to do is get better at discussing quality of life from an earlier stage, get better at incorporating really proper holistic quality of life assessments into our decision makings in terms of treatment and euthanasia decisions. So that's really my standpoint on it. And just to loop back, Sean said earlier that veterinary professionals historically are biased towards prioritising physical health, and I just challenge whether that is really historical or whether we still have an innate bias to do that.
You've got less than 30 seconds now.
Sorry.
Yeah, I am a philosopher, so I'm allowed a meta answer. I think it's important to think about that vets have different views of what's the day too early than day too late, and allowing respectful conversation within the profession. I think it will really important for also the bringing down stress levels, having a nicer work environment, that you face these disagreements and have civilized discussion and civilized disagreements, because otherwise it becomes extremely moralistic and less nice to be in.
Thank you. So can we please thank our panel in the usual manner?